You take that in the evening, it'll help you sleep. You get like an 80% absorption. If you take magnesium citrate, okay, that's fine too. The other side note I want to mention about magnesium is that the more vitamin D that you take, the more magnesium is going to be required. Some people that take vitamin D, they react, they get a symptom from it, whether it's nausea, heart palpitations, muscle cramps, sometimes it's a headache. Realize that's probably just a magnesium deficiency, because the more vitamin D you take without magnesium, the more magnesium your body's going to have to pull from the reserves. And if you're already deficient, you're going to be really deficient now, thereby giving you more symptoms, which might happen more in the early morning when you wake up, because that's when you have the lowest amount of magnesium in the body. Other mistake that people make with vitamin D is they don't take it with vitamin K2. Vitamin K2 is another cofactor, very, very important, because think about it. Vitamin D helps you absorb calcium in the blood, right? Well, K2 takes that calcium in the blood, drives it into the bone and your teeth. It keeps the calcium out of the soft tissues. What type of K2 do we need? The MK7 version is really good if you have a lot of calcium buildup in your arteries. And it's also really good for cancer, believe it or not. And the amount that I would recommend would be 100 micrograms for every 10,000 IUs of vitamin D3. Next point is another cofactor, zinc. And one of the things it does is it helps you convert cholesterol into vitamin D. I would recommend, if you're taking 10,000 IUs of vitamin D3, to take like 20 milligrams of zinc. Zinc does a lot. In fact, it's a cofactor for all sex hormones.